All right. We're going to give folks a couple seconds to start joining us before I officially announce. But just welcome. Happy Friday. We made it through a work week. It is noon, exactly noon on the East Coast. So you know what that means. We're going to do our Friday webinar. We're going to do a little bit to educate you on some health policy items that are happening right now. The good thing about this particular program, accelerating access to CAR T-cell therapy in local communities, it's more of a continuation of a program that we were able to complete at the summit. And so if you looked at the advertisements this week, we've been showing clips from it, and you'll see Angela Moore on this one as well. You'll also see Abigail and Rosalind. But moderating and keeping this discussion going is Pamela Barnes, who's at Bristol Myers Squibb. She's a member of our NMQF Corporate Roundtable, and she's always educating us on things that we need to be doing, trends in health equity, health education, and public policy. So without further ado, I'm literally, like I always say, I'm gonna turn it over to the real experts in this space. But before I do that, I just want to make sure I take care of some housekeeping items. One, if you have a question, as you know, please put it in the Q&A box that's below your screen. And then two, if you have just some commentary that you want to make or some links to websites you want people to take a glance at during the conversation, please put it in the chat box. And that's actually all I have. So I'm going to turn it over to Pamela.
Thank you for that, Brandon, and good afternoon, everyone, and welcome to our webinar on accelerating access to CAR T-cell therapy in local communities. Again, my name is Pamela Barnes, and I am from Bristol Myers Squibb, where I'm the Director of Federal Strategic Alliances, and I am honored to be your moderator today. You are in for a real treat. We have an esteemed panel of experts who will share their insights on this very critical topic. So let's go ahead and get started. Our first panelist is Angela Moore from Bristol Myers Squibb. And Angela, can you get started by explaining what CAR T-cell therapy is? And additionally, can you discuss the significance of expanding access to this therapy within local communities? CAR T-cell therapy represents a groundbreaking advancement in cancer treatment, offering hope to many patients. And so understanding its fundamentals and the importance of making it accessible to more people is crucial. And Angela, so we're very eager to hear your thoughts.
Sure. Thank you so much for having me here today, and thank you for the opportunity again to speak about this. CAR T it stands for chimeric antigen receptor, and the T stands for T cell. And what that really means for us is this is probably the most personalized form of medicine that exists today. And we take our own body's natural ability to fight cancer and we reactivate it. So we remove the patient's cells. We attach a protein to them and modify them. We put them back into the patient's body, and then we allow the body to naturally fight the cancer that is growing. And where it's interesting that not everyone may be aware of, CAR T has been studied for over 30 years, starting in the university setting. So there's a long history of this technology and this personalized medicine, but we still see that today only 2 in 10 patients are receiving the treatment. And why is that painful to me is that we have found that, especially in the blood cancers like lymphoma, patients are approaching a cure. And that means that they are in remission for very extended periods of time with no detectable diseases. And what is the significance of expanding that to the community? With many technologies, we find that it stays available to certain populations. CAR T is no different. In our analysis, we find that it tends to skew towards white, male, affluent communities, typically located in low urban areas or in centers of excellence areas with academic institutions. And that precludes our ability for patients who may live somewhere else, look somewhere else, or make a different income, having access to something that could potentially be curative. So, what we're focused on, and why I'm so excited about this today, is what can we do as a collective community to expand access to the patients locally, we know we can improve outcomes by putting patients on a path to a cure. We can find ways to reduce that travel burden, which if you have a family, you have children or your parents that you need to take care of, you may not be able to travel away from your home. So if we bring the treatment to you, you can access it. We know that we can improve healthcare equity by ensuring that all populations, regardless of their zip code, their race, their income levels, can have a chance for a curative cancer treatment. And we know that we could support the local communities. Healthy communities lead to better outcomes all the way around, up to and including better economic outcomes, et cetera. So you can see I have a lot of heart for this. So I'll wait for that. I'm looking forward to hearing from the rest of the panel, but most certainly excited about making sure that more people can access this treatment.
That's great. Thanks so much for that explanation, Angela. And we're definitely looking forward to hearing more from you. We're going to transition now to Abigail Newell from the cancer support community. And Abigail, your organization has conducted focus group research on this topic. In addition to providing direct patient education on CAR-T and navigation services free of charge. And what did your qualitative research reveal about patients' lived experiences with CAR T cell therapy?
Wonderful. Thank you so much, Pam. Cancer Support Community has been a leader in providing patient navigation for those going through CAR-T, advocating for CAR-T access at the state and federal policy levels, and most recently, we've been conducting patient experience research about the importance of accessing CAR-T in the community setting. As you mentioned, Pam, we recently led a qualitative study in which we began by conducting interviews with key opinion leaders in the space of CAR-T therapy, including healthcare providers, social work navigators, and policy experts. And the purpose of these interviews was to get a really broad overview of some of the systematic barriers to CAR-T access and why it's important for patients to be able to access CAR-T therapy. And as Angela put so well, bringing CAR-T closer to home, bringing CAR-T to where people live is a way to improve health equity. Based on these interviews, we then designed a focus group study in which we gathered patients and caregivers for them to share their experiences with CAR-T at different types of care sites. The goal of the focus group was to better understand the barriers to care and why having access to CAR-T closer to home is important for patients and caregivers. And we included caregivers in this discussion because for CAR-T therapy, it is required that patients have some level of symptom monitoring 24/7 in the weeks following the therapy. And this kind of creates a significant barriers for caregivers. And so we wanted to make sure that we engaged caregivers and loved ones of patients as well. After this focus group, we found that there are three major reasons why it's important to make CAR-T accessible in community settings. First, time is of the essence with CAR-T therapy. It's critical that patients get referred timely and that they get access to CAR-T therapy before their disease progresses. Because CAR-T is often recommended as second or third line therapy, these are patients who may have already been through intensive chemotherapy, for example, and so their immune systems might be depleted. And so if you're having to receive CAR-T somewhere away from your community cancer center, you're having to travel, you're having to coordinate that care, you might actually delay the process such that the patient is no longer eligible for the therapy because their disease has progressed. So it's essential that we, reduce those barriers, especially the time to get that care. We also want to make sure that patients are getting referrals to CAR-T in a timely fashion. So some of our healthcare providers mentioned that referring oncologists sometimes perceive patients as unable to receive CAR-T if they lack social support, if they're socioeconomically disadvantaged, depending on their race and ethnicity, right? And so we want to make it easier for providers to make those timely referrals. And if patients have access to that care at their care center, if providers get to continue that continuity of care, right, they're going to be more willing to refer them. One of the most significant barriers to CAR-T is related to the direct and indirect costs of care. Although insurance coverage of CAR-T therapy has expanded over the last 5 to 10 years, patients and caregivers reported significant burden. In particular, one caregiver shared that her out-of-pocket maximum for CAR-T therapy was $12,000, and she and her husband had to dip into their retirement funding and their savings to be able to cover that cost. In addition, some payers require that patients travel to academic centers to receive CAR-T therapy. So for example, one of our caregivers shared that her son was receiving CAR-T therapy at a community cancer clinic. And when he was referred to CAR-T, their insurance provider required that they travel 100 miles to an academic center that was approved under their plan instead. And so that was a significant time burden. That was a significant financial burden for them, who were already paying about $800 a month for their son's insurance every week. This also means that when patients are having to travel for CAR T, they're often required to stay close to the hospital for about 2 to 4 weeks after they receive the CAR T infusion to monitor symptoms. And so this can mean staying overnight in the hotel, having to get a short-term rental. This is incredibly expensive for people who've already been through multiple rounds of therapy beforehand. Of course, there are also indirect costs related to CAR T. So, for example, patients have to take time off of work, caregivers have to take time off of work, and have to arrange care for other dependents and pets. For example, one of our caregivers shared that she and her husband had 2 young children at home when her husband went through CAR T therapy. Their in laws, who were retired, had to come stay in an Airbnb in their neighborhood, and for them, it was a significant cut in their overall income for that month because they had to pay for that Airbnb. Other patients shared that their caregivers exhausted their paid family leave. They exhausted their paid vacation days to come care for them. And so, what I want to emphasize here is that this financial impact doesn't just impact patients and caregivers, it impacts their broader community. We had another patient who shared that she had a friend fly in to be her caregiver who abandoned her small business and lost wages for a month in order to be her caregiver, right? So, this financial toxicity is a significant barrier to CAR T. And if we can bring CAR T closer to home, we can mitigate some of that financial toxicity. Finally, and most importantly for us here at CSC, we found that when patients had to travel to academic centers and when they had to travel far away from their community care setting, this exacerbated the psychosocial distress associated with receiving CAR T therapy. For patients and caregivers, CAR T is really exciting, but it's also an innovative treatment and it can be scary. Patients and caregivers are worried about potential side effects. And so they want, there's a lot of stress for both patients and caregivers leading up to CAR T therapy. And for caregivers in particular, having to monitor symptoms in the weeks following CAR T is a significant burden. Some of our caregivers actually described it as quite traumatic, worrying that their loved ones' lives were in their hands. One patient shared that she actually had a hard time finding friends who were willing to provide that symptom monitoring support because they were worried that they would miss something. So this is a significant way of experiencing distress, and we want to make sure that patients and caregivers have access to their local support networks. So if you have to travel 100 miles away from care, you're away from your social support, your network, to help provide that emotional support and lessen some of that psychosocial distress. So it's important to bring CAR T closer to home to lessen the financial, psychosocial burden, and time burden associated with CAR T and increase access and quality of life for patients, caregivers, and their communities.
Well, thank you so much for sharing, Abigail. Patients' experiences provide invaluable insights into the real world impact of therapies, and your research shed incredible insight on the human side of CAR T cell therapy, which is often overlooked in clinical discussions. And I think a lot of times when we talk about why it's important for CAR T cell therapy to be in the local communities, we miss the human side of that. And I think your qualitative research really did provide kind of that human side of why it's important and what patients and their family members also often go through. So really thank you for sharing that as well on why it's important for CAR T cell therapy to be closer to local communities. I want to kind of go back to Angela more a little bit and kind of discuss a little bit more on some of the barriers to accessing CAR T cell therapy in local communities. I know that you have done some work on identifying the barriers that are essential to overcome for patients and getting to that innovative therapy as well. So, Angela, can you provide some feedback on how we can go into addressing some of these barriers to accessing CAR T cell therapy in local communities?
Yes, thank you. And Abigail really hit a lot of this on the head with her concrete patient stories. I'll tell you that there are many buckets of barriers that we've studied and observed, but I'll talk about three right now. One I'll use your word, the financial toxicity bucket. From our perspective, we have found that there are certain payers, due to the way our system is set up in the States, that exclude CAR T, leading to lengthy prior authorization requirements, hurdles that patients have to go through when they themselves and their caregivers are dealing with a debilitating disease. So that's a barrier in the way our insurance system works here. And we have many ways to try to support that, but not all of those ways that we could provide as an industry and or foundations tackled those issues. The second bucket that we see is one that is not always clear on the surface, but in terms of going broader and really bringing cellular therapy to the community, there are accreditation processes that I would argue are a bit dated and don't reflect where the therapy has evolved. As I mentioned earlier, CAR T has been studied for 30 years. We have been making strides in what this treatment is and is not, and we've made great strides in being able to safely administer it to patients. However, some of the local community providers may or may not meet these accreditation requirements because some of it's costly, some of it's lengthy, but that doesn't mean that they can't provide the care. And we've seen a similar analog in some of our efforts to expand diversity in clinical trials, where sites that are located in the certain places may not have all of the accreditations or parameters, and we just need to work to get that addressed. We have a rigorous process, for example, at Bristol Myers Squibb that we do to onboard the sites to make sure that whatever we deliver in the community will be just as high quality as what we deliver at a large academic institution in an urban area, but it has been a barrier. And the third barrier that is one that we've all touched in some form or fashion is around education and advocacy. Despite being studied for 30 years and available commercially since 2009, there are still myths that we need to debunk about what cellular therapy is and what cellular therapy isn't, from the patient, the caregiver, the provider that would refer the patient in for evaluation of CAR T, and even with some of the physicians that administer CAR T. So along the whole continuum, we have an opportunity to educate, because some things you'll see, for example, Abigail touched on, at that point of possibly sending in for evaluation, due to unconscious bias and other things about perceptions of the disease, patients don't even get sent in to be evaluated because of a misperception of the patient's characteristics, both clinical and non-clinical. The way CAR T works, people aren't clear. And then in the community setting with patients, we see a barrier of just making sure, well, we have an opportunity, I should say, to make sure that patients are really clear on what this is and what it isn't, and what we are doing to your immune system, your cells, and what we're not doing, right? And how this works and helps. And the other area that we have to demystify with patients is what resources are available. It is not always evident that resources can be provided. And I thank you to the person in the chat that provided information about North Carolina, but some of that is still kind of grassroots, and not everyone knows where everything is. And that's a big barrier, because if you don't know that you could get a support, you may self-select out, even if you have been educated on the potential curative potential of CAR T. And I could go on for hours, but those are the main ones.
No, that's great. And I do want to bring Rosalind in. But Abigail, can you mention briefly the navigation services that CSC provides? 'Cause I think this is a really good segue just to mention that briefly. Because you're right, Angela, not everyone knows kind of where everything is in that connection. And I think that support is very important, because this has been studied for a very long time, but it is cutting edge, right? And this navigation support is very critical, right? And so we'll talk about the navigation services, and I do want to bring Rosalind in, because she does have CAR T advocates who does a lot of this work as well. But Abigail, can you mention the navigation services also, and then we'll talk about a lot of the great advocacy and education work that Black Health Matters does.
Yes, so Cancer Support Community has our CAR T concierge program, in which we have a professional social worker who is an expert in all of the resources available from start to finish for CAR T. And you can call into our helpline at Cancer Support Community free of cost. Get connected to our professional social worker. Her name is Gabrielle Winther. She is incredible. She can help find lodging, transportation, financial assistance, and she can provide emotional support before, during, and after the CAR T process. She can help find resources in your area and kind of aggregate all of those supportive resources that Angela mentioned. And I can share that a lot of our focus group participants as well were disappointed to learn about resources after they had already gone through CAR T that would have saved them time, money, and emotional distress. So I think as we work to bring CAR-T closer to the community, we need to popularize and consolidate the amazing resources that exist. So I will share in the chat the number for the CAR-T concierge helpline, as well as a link to a form that you can fill out online if you'd like a referral to the helpline as well. So thanks for that, Pam.
Great. Thank you so much, Abigail. And Rosalind, I'm going to turn to you right now. One of the challenges and barriers that was mentioned was education and advocacy, and continued education and advocacy are needed to ensure patient access to cell therapies and outpatient and community settings. And we know that community education plays a pivotal role in education. And how does Black Health Matters, and how does your community events and summits help bridge the gap in education and awareness?
Thank you, Pam. Thanks for that question. So, Black Health Matters is a platform that seeks to educate and empower families of color. So, we use a ecosystem for education and awareness because we want to be able to touch people and patients and caregivers in very different ways because we all receive information in different ways. So, we have newsletters, we have a website, and we also have strong community relations, which lead us to our empowerment programming, which is based and rooted in the community. What's really well known about Black Health Matters are educational summits, which is symposia rooted in the Black community. Through these educational programs, which are all very, very clinical, it gives a perfect path to education and awareness. What we know is that there's magic in the air because people can tell that this event is created specifically for them. We are able to speak to raise, again, condition specific issues that patients face. And it might be the very first time that a patient or caregiver has come into a clinical environment and felt really good about it. They're not rushed. They can learn at their own pace. There are community resources there, and there are navigators and also screenings. So this gives you a baseline for which to work with. When it comes to discussing and raising awareness of CAR-T, it's a very complex topic. And so what we know in terms of some of our data is that when we promote a CAR-T session, we don't have a lot of people on initially opting in to say, wow, we're going to a BHM summit to learn about CAR-T. But after the presentation, the CAR-T presentations come in at like 1 or 2 in terms of receptivity. In other words, they didn't know what they didn't know until they saw it and were amazed by the level of education that the presenter was able to share and also how it applied to their daily life. Based on that, we know that our attendees are having follow-up conversations with their physician, they are sharing it with friends and family, and they are really intentional about learning more about CAR-T.
Can you tell us a little bit about your advocates, the CAR-T advocates?
Oh my goodness, yes. So we were in Harlem a couple of years ago, and it was wonderful in that 2 advocates from Brooklyn Methodist came, and they shared what their stories were. And then they said, we're going to help Black Health Matters raise awareness and your own knowledge about how to engage with patient communities. And so it was a clinical oncologist and her also her co-worker. And so what they shared was really interesting for BHM in that, here they are very active in education. Obviously, they're out in the community. They were saying that there were no set places in Brooklyn where folks could actually sign up and have CAR-T. And so that could be a problem because for some folks, they'll never go to Manhattan. That is kind of like a fate worse than death. So, and with the higher rates of CAR-T, excuse me, of diseases like lymphoma or multiple myeloma that are based in the Black community and concentrated in Brooklyn, one would think there would be something available to them, and that was not the case. So what they spoke to us about and what they're helping us craft for our next summit, which will be held on August 14th at Riverside Church is a folksy approach, speaking with our BHM audience about not being fearful, because again, it is very complex. What will that person entail? So speaking in terms of what they understand the patient journey to be, and again, their support in numbers. We'll also have other resources, other people who have actually been on CAR T, so that they'll be able to see in real time and receive in real time information on how to live their best life through this educational environment.
Thank you so much. And when I say that the summits are fun and energized, like, you will not know that you are actually learning and having fun at the same time. Like, you will. So go online and learn more about the Black Health Matters summits. It's truly a wonderful experience to learn about your health at the same time as well. Rosalind, how do you conquer learning about health and treatment and being confident about asking questions to your healthcare provider? A lot of times patients might feel awkward in asking your healthcare provider certain questions about their health. So kind of how do you combat that and making sure that your patients feel confident asking questions about multiple myeloma and like being a trusted source for people. A lot of people now go to social media, to get their healthcare information. So kind of how does Black Health Matter employ different platforms and strategies to help patients feel more confident in asking questions?
So again, that is so incredibly important that we normalize the process of asking questions. It's not as though you're trying to tip the scales or be challenging, but an empowered and a well-informed patient will take and learn what science has to offer. So it's always about evolving with science. What we say at our summits is that your physician, your specialist, is really only going to be responsible for 20% of your care just over time, and that 80% really relies on you. So again, through Black Health Matters, which is helping present and share and inform on a variety of different disease states, including CAR T and blood cancers, allows you to have a representative, something that's culturally important to the patient community, to caregivers, that help them see themselves in this patient journey, because there is so much to learn and it is a new modality. So because we are trusted in the community, because we do trustworthy programs and we utilize the trust to be the foundation by which education and the ability to thrive happens. So you'll have the opportunity to interact with healthcare providers. You have the opportunity to possibly be screened for a variety of different conditions, including blood cancers, and you will interact with HCPs. All this, again, folks don't really understand until they go, how when you feel supported, you leave feeling empowered. And that leads to more questions, to more interaction in the healthcare ecosystem. So we seek to be able to mentor, uplift, and empower.
That's great. Thanks so much, Rosalind. I'm going to ask our panelists our last round of questions. But while I do, I will ask our participants to go ahead and type in any questions you might have using the Q&A function. So you can go ahead and do that now, and I will go ahead and ask our panelists our last round of questions. Okay. So before we conclude, I'd like to ask each of our panelists to share a key message they want the audience to take away from today's session. So Angela, Abigail, and Rosalind. Let's say we're good on time. So let's say in 5 minutes or less. What is one important point you want our listeners to remember? And I'll start with Angela, and we can go down the list. So we'll start with Angela. We'll go to Abigail and Rosalind, what is one important key message that you want our audience to remember?
Okay, so one message. I will say the first, and then I'll give you a sub message. It takes a village to deliver CAR T therapy to patients. That means that we all have to work together, whether it's providers, policymakers, community leaders, church leaders, academics, industry. We have to work together to tackle these barriers. No one group will make it alone. And if I do one thing as just that group of community can focus on is really helping people to understand the potential benefits of this treatment. I believe if we start there, then we can start to address some of these other barriers. But I love Rosalind's example that it's not the highest thing that people select to go in, but once they leave the sessions, they find it to be the most interesting, which tells me that people don't know what they don't know about what this could do in terms of a potential cure for their blood cancer.
Thank you. Abigail?
Yes. I think we want to make sure that everyone who is eligible for CAR T therapy has access to the therapy in order to reduce disparities that we see in cancer diagnosis and morbidity and improve health equity. However, we also need to consider that CAR T can sometimes exacerbate the financial time and psychosocial burden associated with cancer treatment. And so bringing CAR T to the community would not only increase access, but would also lessen the burden of CAR T for patients, families, and their communities, and would improve overall quality of life. So while we think about survivorship and long-term survivorship, as Angela mentioned, which is one of the great promises of CAR T therapy, we also want to think about improving quality of life for everyone after they receive CAR T therapy to make sure that they're not going into medical debt to receive this, to lessen the time and financial burden of CAR T, and to make sure that people have the emotional and social support that they have close to home. And again, this is important not only for patients, but their families as well as their communities. And again, at Cancer Support Community, we've tried our best to make sure that we have support from end to finish, from the beginning of when you're referred to CAR T, all the way through your follow-up and into survivorship through our CAR T navigation and our education support. And the work that Rosalind does is so imperative, and making sure that patients and their families and caregivers are are empowered. Because when we think about the misperceptions that providers have when they assume you might not actually be able to go through CAR T therapy because of the color of your skin, how important it is for patients and their families to be able to speak up and know about CAR T therapy even before they're referred. So it's really important to get that education out there well before you ever are actually referred to CAR T therapy.
Rosalind?
I would say, please, 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 when there are opportunities that come to your neighborhood, take advantage of them. Take a chance, spend some time, invest in yourself. One of the things that we always share at our summits is that every year your physician has to have a certain number of credits towards their education to maintain their medical license. They have to understand what's new in science, what it means for various populations, what the outcomes will be. And just as they have that rigor, we need to place that on ourselves. And there are so many places in the community where you can avail yourself of this type of information. Black Health Matters is an environment that pairs science and community, and so that you can feel welcomed, you'll feel respected and trusted. And so all of this will help you as you have to power through situations that can be uncomfortable. But again, know that there are resources there. Our digital website will provide content that is evidence-based, and we have an amazing channel that speaks to CAR T as well as blood cancers. We do screenings at our events. I recall, a year and a half ago, we did a screening. We screened 48 people for blood cancer, and of that, 8 people had to be recontacted. So you just don't know until you put yourself in an environment where you can benefit and learn. So we ask that you be resourceful, be positive, and check out Black Health Matters for the services and support that we can provide.
All right. Well, thank you so much. We don't have any questions here. I'll say we don't have any questions here But we do have a very active webinar chat with links to websites, phone numbers, on how to get in contact with the navigation referral service, blackhealthmatters.com. So please feel free to access the links and the phone numbers that are provided in the chat, and follow up with our panelists as well as NMQF. Also, thank you so much to our host, NMQF, Dr. Puckeren and his terrific group, Brandon and Ashley. I believe this will be posted on YouTube, if not today, early next week as well. And I do want to take a moment to thank our wonderful panelists for sharing their expertise and insights today. It's very clear that accessing CAR T-cell therapy in the communities are crucial and very important for improving patients' access. And do appreciate everyone who did join us today for this very important discussion. If there are any final words from Brandon, I'm not sure, but if not.
No, well, I just want to say thank you for organizing and getting together, and thanks for your expertise in this. Really helps out. I was like, my question was like, what else? I mean, honestly, I did have a question. I was going to say, just what else can NMQF do in this space? Like, are other groups that represent, I have like our patient advocates in this space. What else can be done? I know we tend, obviously we work with you all a lot, but any other things that we can do to promote or help or assist in getting the word out and letting people know about it, but then two, not only knowing about it, but the advantages of it as well.
Yeah, I think we did discuss some of the barriers, and I think that we can kind of address some of the barriers, like one by one would be a step forward. And then also there is a very tremendous pipeline in CAR T-cell therapy. So for example, we have an autoimmune pipeline that we are very much looking forward to in the lupus and MS space, which impacts the African American community also. And I know, and I spoke to Dr. Puckering about this. You have a campaign in lupus that you recently started as well. So I think that's something that we can, discuss also. So that's just something off the top of my head. But of course, Angela and Abigail and Rosa may have thoughts also.
Yes, I would add, continue to amplify the message as you are doing. So more of these sessions, more of what we did in DC, and then explaining to patients and help patients, people, providers, this village, this community, what these innovative treatments are and what they are not. So even simple things as posting this webinar so that it can be accessed over and over and over again, pulling clips and repeating the information over and over again. Those things help us all, because I think your organization gives a level of credibility to things that the industry may be saying. I think less so for Rosalind and Abigail, but as an industry, I find sometimes communities receive our messages mixed. So you all can help add credibility to the fact that we're here, we're following the science, and we're trying to help patients. That would be an area that I would ask to continue to do, because I know you're already doing it.
Good. Yeah, well, then Ashley's all over that, so good.
And I do have a question here about the lupus treatment that I just mentioned. So that is I believe last year during ACR, BMS released there's a press release that BMS released about the lupus pipeline. There was a press release. So that you can go on bms.com and find some information about the pipeline in the autoimmune space.
Yes.
And that'll be the latest and greatest.
Yes, and those are investigational treatments for lupus, but certainly please check it out. And you can also ask in your local community if your provider has access to clinical trials in that space for cellular therapy. So ask if it could be available to you in a clinical setting.
That's great. And another resource is clinicaltrials.gov. And that generally pulls up all the clinical trials, and it provides information on the qualifications for the clinical trials. It's like another resource.
I just wanted to add, Brandon, to your question and what y'all can do to support this work. I think incorporating patients' voices and experiences throughout our advocacy as well as our support is essential, is having those patient voices there. But we see time and time again that patients are asked to come to state capitals and testify. And for a lot of them going through this, their quality of life matters, their time matters. We don't want to waste it. And so everything that we can do to amplify the voices of those patients without having to overburden them is amazing. So providing the opportunity for patients to share their stories, whether that's secondhand through research or through direct advocacy, is essential so that we're not overburdening patients, but we're still making sure that they have the opportunity to share their experiences. Some of the patients and caregivers who participated in our focus group also had gone to the Capitol to advocate, in fact, for increased access to CAR T, as you mentioned, Angela, in regards to some of the accreditation issues that some hospitals face in getting access to CAR T and what that would mean for patients. So I really appreciate y'all providing us this opportunity today.
Well, thanks for answering the question and getting us more. We will continue to follow it. I don't know if Pam, did you want to say anything else or Ali?
I think that leaves it for today,
All
Brandon.
right. Well, cool. Well, thanks everybody for joining us. Like she said, this will be available. I think it'll actually be available in a couple of hours on our NMQF YouTube page. Um, Please follow BMS and the other organizations that are mentioned here and learn more about it. And with that, I just want to hope everybody has a good and restful and impactful weekend, or do nothing, just enjoy yourselves. How's that?
Right.